new to this specific specialty. So if you could introduce yourself and then share what your specialty is and what brought you to that, that'd be great. And Greg, we'll start with you.
All right. Well, my name is Greg. I am the second class of MSN CNLs at Georgetown. And while I was in school, I was also a medic and an emergency room tech. So obviously, where did I go first was the ER at Children's. I guess I had done my practicum there too. So I had been there for a little bit. So it was all about not the adrenaline piece of it, but the fact that it is constantly changing, and that it's a kind of a thinking game every minute because you never know what you're going to see. And I had come to nursing late in life. I had been a lawyer for a long time, and then I retired and ended up back at Georgetown. So it was sort of, I had already been moving towards emergency when I started, and then true to form with nursing, I found other things that were great. And now I'm actually back at Georgetown in the clinical research unit. After having been over at Walter Reed for the US Navy for a while, doing COVID research to try and build some vaccines and whatnot during the last couple of years.
Hi, everyone. My name's Laura. I'm glad to be back. I think I did this a few years ago with some students. So I graduated from George Washington University's accelerated BSN program. So I'm a second degree nurse. I actually started off in the ICU realm right off the bat, which was a huge learning curve. During my senior practicum, was able to work at MedStar Washington Hospital Center's burn trauma ICU. And I became in love with that population, that unit specifically. So I worked there for 3.5 years. It was a great experience. And I kind of fell upon it with my senior practicum and really loved working with the patient population. As you said, Greg, you're kind of, what comes in the door is different for every patient in the trauma and burn realm. And so you really do think on your feet. And it's a great learning experience.
Hi, everyone. I'm Jen. I am a travel nurse. I have been a nurse for 6 years now, and I've been traveling for 5 of those 6 years. My primary specialty is cardiac step down. I also, being a travel nurse, have floated to almost every area of the hospital, except, psych, L&D, super specialty areas like that. So primarily I do cardiac. I have worked in multiple hospitals across the country, all the way from Colorado to Virginia to the Carolinas. New York's where I'm from. I have worked community hospitals. I've worked in level 1 trauma facilities. I've done float pool, step down units, neuro, ortho, everything you can imagine. So travel nursing allows me to do what I like, which is I like to kind of change around. I like to be adaptable and get experience from all areas as being a nurse. And it's given me a really great background. And I'm using that to go for my acute care nurse practitioner. And I'm about halfway through that. I'll graduate next April. So travel nursing is great for experience, getting a wide range of background and seeing a little bit of everything.
Hi, everyone. I'm Juliana Gonzalez. I actually go by Gigi. I went to Georgetown's nursing school and I graduated NHS in 2014. And I was actually part of the Student Nurses Association when we tried to put something like this on, as well as in person at that time. So I'm glad that it's still being held because it was very helpful for me at that time. I graduated from Georgetown and then I actually went straight from undergrad to grad school to pursue my pediatric primary care nurse practitioner degree, which is not very common. And so I was like the only one in my class to be straight out from undergraduate. So it was very intense, but I was very blessed and lucky to be in a program that supported me through it. I graduated and my dream was to work at Mary Center, which if the relationship continues, we hear a lot about Mary Center as an undergrad at Georgetown. And so I'd done some shadow experience there, also as part of the Student Nurses Association. And I've been working now there for the past 7 years, which is crazy to think about. So it's actually a funny question how I ended up working with peds, because I was convinced that the last thing I wanted was to work with kids. And then once you go through clinical, I realized I loved working with families. I loved working with kids. I liked the spunk and the zest of it. And initially, I thought I wanted to do oncology. And so I did a summer nurse extern program at Georgetown. And that quickly showed me that that was not the right fit for me. I wanted something just that was less heavy. And I really wanted outpatient experience, which we didn't get a lot of when most of our clinicals are in the hospital. So it was actually through one of these panels that I was able to shadow a nurse practitioner, and I fell in love with her day-to-day life. And I found that doing pediatric primary care was the right thing for me. And I definitely chose the right profession for my personality.
Okay, and last but not least, and probably the most experienced here, I use experience, not oldest. I have actually been a nurse for, I'll say, more than 30 years. Let's just keep it at that. I graduated from Georgetown and worked in the surgical ICU at the time, Georgetown Hospital. So that was my first job. I did my practicum at Georgetown in the surgical ICU and just thought, this is the greatest, right? And so I thought I was so lucky. I graduated, I had a job, I took the summer off, I traveled all over the place. I started work and soon could not believe that I had done this to myself, because all of a sudden I was not a student anymore, I was a nurse. And I really thought I was going to kill everyone I touched. And that is not an exaggeration. So just be prepared for the fear when you actually move into the real world. It will pass and you will all be amazing, but it is not an easy transition. After saying that, nursing has been, aside from being a mom and a wife, nursing has really been the most rewarding thing in my life. And how I got here, it's very circuitous. I have really had the opportunity through my career to do a lot of things. I have been a surgical ICU nurse, a medical ICU nurse, a critical care nurse in cardiac. I have been a hospice nurse. I have worked in oncology for many, many years. And probably the most odd and least fun job was I was a school nurse for 5 years. And while that is a very challenging role in a very different way, it did give me an opportunity to never miss anything with my kids, right? And so I think the one thing to remember as you start out on your very young career, nursing will give you a path for whatever you need to do in your life. And there's never going to be something that you want to do as a nurse that will not fit with your lifestyle. And don't let anyone ever tell you you can't go back to do something, because I was a school nurse for 5 years. And as soon as my girls were out of the school system, I was like, back to oncology it is. And so, you know, I really pushed through. Currently, my role is at Johns Hopkins. I'm a senior director of nursing for oncology for the Hopkins health system. And really love every minute of it. I'm not sure if I love the oncology piece, the leadership piece, the patient piece, or just sort of the leadership development. I don't know what I love most, but I can tell you that, you know, definitely all of the experiences I've had as a nurse have made this experience today just a really wonderful, rewarding career, profession, and lifestyle.
Perfect. Thank you so much. Everybody seems really passionate about their specialty, whether they knew it from the start or they just got there somehow. We've never had a school nurse specialty. So Donna, at some point you'll have to talk about that too. And so, yeah, I would just love to hear next, like, what does a day in a life look like for you? How do you treat patients that might be different than other specialties? So Greg, you can start us off.
Well, so I can speak from a number of different specialties. We'll start with the ER, which was my first real love of nursing, actually. And what's different about that is that you see your patients for a few hours. It's the worst few hours of their lives, and it was pediatrics, so it was the worst few hours of their parents' lives too. But then you don't see them anymore, as opposed to if you're ICU on the floors, oncology. Some of those people you get to know for days and weeks and even months or years. So it's a little bit different in the ER day in your life, because not only is the work always changing and the acuity level goes up and down minute to minute, the patients change in terms of what they are and have, but then you really don't get to know them the way that you might in another specialty where you spend some time. So after emergency, I went to trauma psychiatry inpatient, where I got to know some of the people a little bit more. And then you start to, like, I don't know, you learn more about yourself in a way while working with them because of every issue that they have. And you can, like, I'm a dad and a husband and all these other things too. And so I had pediatric patients in psych as well. And so I saw myself, I saw my own kids in them. And so that was a real different experience too, because then you start, it's not an empathy thing as much as a sort of, wow, their life is my life and my life is theirs, and see how differently stuff can turn out. So the day in the life of your specialty for me, it changed every day. And I could see the difference between the kind of place where you were acute care for a short period of time versus acute care or long-term care for longer periods of time. And you really got to, get into people's lives along with you.
Yeah. So for me, being in the ICU, especially focusing on the trauma burn population, I do get the pleasure of working with some of these patients for months. And they try to continuing, to keep the nurse and the patient relationship close. So if you've worked with that patient before, they try to return you into that room as much as possible, because that really can help with their healing process as well. And it helps with communication between you and the patient and you and the family as well, because they know you, they feel comfortable, they trust you. So yeah, with some of our burn population, they can be with us for up to 3 months before they get transferred even to the step down. And they can be there for a while too. And they'll come up and say hi to you and visit with you. And then at MedStar, we also have a burn rehab center as well. So even when they get discharged from the hospital, they're still coming back and working with PT, OT to continue with, burn care. And they still will come up and say hi. So it's actually really nice because not always with the ICU population do you get to see them in the recovery phase, in the phase where they're walking out of the hospital. And so it's really nice to be able to have that experience still and to really ground you and say, okay, I'm seeing the tough, critical part, but this is what happens in the end, hopefully. So that's, it's nice to be able to see that.
So as a traveler, my specialty truly changes every 13 weeks. So I'll speak to kind of what a contract looks like for me. So like I said, a typical contract for a travel nurse is anywhere from 8 to 13 to 26 weeks. So I will get offered the job through a recruiting agency. I will accept the job and I'll have a start date. And on that start date, it's usually about a week of computer training and policies and procedures. And every hospital I've learned has the same policies and procedures, really. So after that first week, we get our schedule for the floor and we hit the ground running. I usually get anywhere from 4 hours to 2 12-hour shifts with a preceptor, which is a staff nurse or sometimes even another traveler if they are really short-staffed. And we, after that, are expected to be independent team members. So it depends on what specialty I'm working in. As of right now, I'm in Maryland and I'm working on a PCU, a progressive care unit. And it's much different than a lot of the other progressive care units I've worked on. I've worked on progressive cares that take vents and trachs, and there's only a 3-to-1 ratio because you have a lot of drips, you have a lot of, step down patients. But the PCU that I'm at now, they can't do a lot of things. It's more of just a telemetry unit. So you kind of have to be able to roll with the punches and learn where you are and what the kind of culture of care is there. So it's very interesting to work at so many different places and to see how they function. And I can pull on my experiences from one location and bring it to the new one. And I try to bring, good suggestions to management and things like that. So it's very interesting. And then at the end of my 13 weeks, I just leave and I'm on to the next one. So it is certainly a very tenuous path, getting contracts and doing the training every 3 months or so, but it's well worth it and it's really exciting. So every day really is so different.
I guess I'm next. I love hearing about everyone's experience, by the way. This is so cool. A day in the life. No day is the same, which is, I think, part of what I love. But at the same time, these are families that I know very well, that I know since they were newborn, and now they're 5, 6, 7 years old. They have a sibling. I've been able to see families go from homelessness to now they have a home. Now the parents have a job. The kids from developmental delays to now doing well in school. And I can see anything from a newborn, a 32, 34 week preemie and very nervous first time parents, to the regular, day in and day out bread and butter of here's how you're growing and here's how your development is, on track, and discussing vaccines at well child checks, to the acute visits of it's a cold, it's an ear infection, it's a UTI, or for my teenagers, it's an STD and we need to talk about safe sex and get you on birth control and how to talk to mom about things at school. The regular parent counseling from, how to get your toddler to eat veggies, to how to talk to your teenager about tough subjects like drinking and sex, or how to navigate the system with your child who was just diagnosed with autism. So it's a lot of, the physiological processes and being able to identify, is this a child with a rash and depression, or is this something that we need to do a differential and is possibly lupus, and I need to coordinate that care with their specialties. So lots of science to it, but also the art of parents will bring me their mail and ask me what should I do with this? Because it's, to them, you're one of their most trusted people to go to with questions. So they come to us for anything. And specifically at Mary Center, we work with the underserved population in the inner city. So lots of either uninsured or underinsured patients. So it's also helping them navigate things like food stamps or access to mental health, assessing social disparities. So a lot in a very short amount of time. I see usually between 3 to 4 patients an hour, usually 3. But the one thing that I do love about where I'm at is that there is a recognition for how important it is for us to have a support system as we're addressing these multitude of issues. So we have an on-site social worker, integrated behavioral health, we have home visiting, we have psychiatrists on board, we even have dental. So if a patient is identified as yes, you have this sick visit, but you're also homeless and you need to apply for stamps, or you don't have issues with transportation, I can connect them to people right next door for us to help families also achieve better health and wellness, but also climb the socioeconomic ladder.
So for me, I would have to echo what everyone else has said, in that every day looks a little bit different, and sometimes every hour looks a little bit different. Although I have to comment for Jen, I applaud you, Jen, because being a travel nurse and going to a different place every 13 weeks, I have seen some outstanding and worked with some outstanding travel nurses, and I have worked with some not outstanding travel nurses. And I can tell just by hearing that you must just be a breath of fresh air when you go into an area. So thank you for what you do. For me, my day is a little bit more administrative heavy right now. Although I pride myself on the fact that I've always maintained my oncology content expert piece, and feel like I could still go and put a line in and access support and do things like that. But really, the crux of my work right now is a lot of creative planning, opening up 24-hour urgent care areas, responding to COVID in a very quick manner. I was in New York City in March of 2020 when the sky fell, and was there all of March, April, May, and June. So trust me, nothing I ever thought I would be doing in my entire nursing career, I did. And recruitment, I love recruitment. I love the fact that we're with this really new group of our succession planning, right? Like, you guys are the future of what the world is going to look like for healthcare. And, I think that all of these things, and kind of my day of kind of, talking with leaders and helping them figure out if it's a good fit, then going up and talking to disgruntled patients and upset families, and just rounding on the units and trying to get to know people. That's what a typical day looks like for me. And that's probably not anything the same each time. It's just sort of the themes of what I do each day.
This is great. Thank you all for this great overview. It definitely seems like all of you have variety in your job, some of you more than others. And the other theme I heard a lot about, of course, is how much patient care, or how much continuity of care you have with your patients. Okay, so let's go to the next question, which is, what is your least favorite aspect of the specialty? And for Jen, if you could share what are some of your least favorite specialties and why, that would be great. For the rest of you, what is your least favorite aspect of this specialty? So Greg, we'll start with you.
I think the least favorite part of any of the places I've been, or hospitals or specialties, is the intensive charting. And it really kind of feels like it takes you away from why you became a nurse, which was to have your hands on people and to be helping them through their, again, even if it's not the worst minute of their worst day of their life, even if you're really part of their wellness continuity, which is so important, it's having to spend all that time and knowing that you're being kind of graded on the paperwork half of what you do, as opposed to the actual what you did for that person that day. I think that is it's not like a terrible thing, but it's my least favorite, in the sense that I feel probably not as useful when I'm just at the computer, charting away, as opposed to listening to somebody or figuring out, what they need to do next. So that would be it. I don't think that there's ever been an actual practice of nursing piece that I found to be a least anything.
That's great. I have a feeling many of you will say that. So maybe try to anything in terms
Sorry.
of, no, that's a good one to start. It's a good one. But in terms of your specialty too, for the rest of you, I'm sure charting could, across the board. But no, it's good. Just want to make sure everybody answers differently.
Yeah, Greg, I agree with you about the charting, but I will give a different answer as well to spice it up a bit. I think for me in my specialty in the ICU, and then with that burn population, it's being your patient advocate, especially when they're intubated, they're sedated, they're on pain medication, so they can't talk for themselves. So your job is to be their eyes, their ears, their voice. And so for me, sometimes the challenge can be, knowing when to speak up to the provider and really try to advocate for what you think the patient needs at that time, especially when you're doing burn dressings. It can be extremely painful. Well, it is extremely painful for the patient. And as the nurse, you need to know when to speak up and say, no, this isn't enough. We need to look at other alternatives or additional alternatives to help control this patient while we're going through these, every shift burn dressing changes. So I think that for me sometimes can be a challenge because you're trying to speak up and just kind of be an advocate to the best of your ability without stepping out of line. So.
I agree with both Greg and Laura so far. Charting and stepping up is a very difficult part of the job. And it takes a lot to do it. And just remembering that we are the patient's advocates, especially for some of Laura's patients who can't speak up. It's really important. So I'm really glad that you said that. And I can speak to travel nursing. The downsides are traveling every 13 weeks and moving is very hard. It's hard to not have roots. It's hard to really grow and learn to love a place. I've had many contracts that I was like, man, if I didn't love traveling, I would have stayed here full time. You really do fall in love with places. And the kind of managerial side, I guess, is our jobs can get canceled at any second. As a traveler, we sign a contract for, like I said, 13 weeks. And if in those 13 weeks, the hospital deems us unnecessary, they can just tell us not to come back. And then I don't have a job. I've been with the company I'm with right now for about almost 2 years, and I have no PTO. I don't have any sick leave. You just get paid your hourly wage and your non-taxable stipends. And that's it. There's benefits, but they're not great. So there's some downsides to traveling. It's made up with in other areas of, experience and seeing new areas and things like that. But it's definitely challenging learning personalities also, I would say, going into a new place and learning, like I kind of talked about the culture of that unit and who are the doctors that are really approachable, who are the nurses that I can go and ask for help, who are the techs that I can go and ask for help, because techs are so important on the floor. It is so undervalued, a good nursing tech. So learning the whole hospital over, like I said, a lot of them function very similarly, but people are different everywhere. So it does take a little bit of flexibility, but you do get used to it.
I guess the part that's the toughest part of my job are the heavy days. You really get to know a family in and out, their interactions, how they respond to one another. And at times you learn things from a family that can be pretty dysfunctional. And I think that the part that I dislike the most is just when I have to get CPS involved. That's Child Protective Services, because you continue to walk with the family through this process. And at times, the person that you're trying to protect the child from is actually somebody who lives in the house. And so those are pretty tough cases.
Well, I'm not going to say charting because I'm probably one of the people that asks you to chart and does your audit. So I'm going to leave that piece out. Although I have to tell you, I do try very hard to work with our Epic teams and our informatics teams and really have an opportunity to make charting meaningful. There's a lot of redundancy in things you do have to chart, but I unfortunately, it is a necessary evil. Just be grateful that you don't have to do what I had to do, which is chart by hand. So so there I dated myself. So just leave it at that. But for me, I guess when a patient is no longer able to find a treatment, when a family has to start down the pathway of potentially discussing palliative care or hospice. Now, that's the rough part, but then it takes a whole nother turn almost when patients are in hospice. To me, that is the most wonderful piece of what I do. So it's a very short period of time. It's kind of that moment where they do have to come to terms with the fact that they have an incurable disease and that no amount of chemotherapy or immunotherapy is going to help them. And that's really hard. But if you can be next to that family and that patient when they're making that decision, and you can help that decision kind of become a little bit easier and then help them on the remainder of that journey, then it's kind of all worth it. So that to me is probably the hardest.
Thank you all for sharing. Those were all, yes, very tough challenges. Really appreciated hearing them. And just, I've always admire you as nurses, but my admiration is only higher after hearing about that. So thank you for sharing that. I think it's really helpful for students to get that reality check as well. So I'm going to ask one more question so we have time for questions. And so I'm going to give you a choice. So I have either, what traits does it take to be successful in your specialty? So feel free to answer that, or feel free to share a piece of advice. I'll give you the choice. So Greg, we'll start with you.
I think the answer to both those questions is almost the same. You're all good people, and in not too much time, you're going to be good and great nurses. And it's all about keeping your eyes and your mind open. When I went through school, a lot of us, I'm going to be emergency, I'm going to be ICU, and that's that. And then everyone went every which direction because they found something that almost like you'll find the thing that speaks to you. And like Jen was saying, it's like if you're going to be like a sponge soaking up skills and experiences, and all these things are going to, you're going to like feel them come into you. And after a bit, you're going to say, I feel really good about being a nurse. I was scared the first day I started. I'm still scared now, but I know what I'm doing. And I know I can get through this. And I know that I'm going to do well. And then after, over time, you'll just keep kind of shaping yourself. And then I think, like Donna said, you might fall into something and love it for 5 years. And then turn your head and say, wow, I just kind of saw that thing. I'm going to go there and be equally as rewarded and feel as valuable. And, you're going to build yet more skills that you can use, and you're going to use your old skills. So I think that those two questions kind of, to me, go together. So the piece of advice is keep your eyes and your minds open, keep confidence in yourself because you're going to be good. And then find yourself, let yourself find that thing that really kind of speaks to you, that makes you feel good about what you're doing, knowing that you could change your mind and move on to something equally as fulfilling, rewarding, and happy.
Well said, Greg. I also think going with that, one of the biggest thing for me, especially kind of coming right out of school and going straight into the ICU field, I think the thing to remember is not to be afraid to ask questions or admit when you don't know. It's okay to admit you don't know in that moment and to ask for help, because as I was saying earlier, you are your patient's advocate. And if at any point you feel uncomfortable or unsure, or you really do have a question that could really make or break, the next step that you take in caring for this patient, speak up, ask. That's how you learn. That's how you, better care for your patient. It's okay. It's okay to admit, especially coming fresh out of school. You learn everything by book, but once you get out there, everything by hand it's a whole new world. So just don't be afraid to ask and to admit when you don't know in that moment. It's okay.
That is great advice. I have two pieces of advice. One's more practical for nursing. One is more personal. My practical advice for my students that I precept, because I do have the opportunity to also take some students as a traveler, which is really awesome because I love to teach also, is know your why. Why are you caring for, why is this patient in the hospital? Why are they still in the hospital? Why are you giving this medication? Why are you charting strict I's and O's for your heart failure patient? Why are you doing the things that you're doing? If you can connect the dots, you will never, well, no, I won't say you'll never make a mistake, but you'll at least understand what you're doing, and it'll hopefully prevent a mistake from happening. If something doesn't make sense, don't be afraid to speak up and ask, hey, doc, why are we giving this medication? Why are we giving this treatment? You'll learn something new every day. Or I ask another nurse, do you guys normally see this on this unit? I've never had a patient, I've never seen this before. What do you guys do in this instance? And I've learned so much by just knowing my why. So that's my practical piece. And it goes off of what Laura said, is know what you don't know and always ask before you do something that you are unsure of. There is never a wrong time to ask a question. My personal piece is to take care of yourselves. Nursing right now is incredibly difficult, and it has been forever, but amplified 1,000 times over the last 2 years with COVID. I was in nurse practitioner school. I started September of 2019, so right before COVID. I got through a year, and I took a year-long break because I didn't know if I wanted to even be a nurse practitioner. I needed a mental health break, and that was okay. There was no way I was going to get through a Georgetown nurse practitioner program working full-time while traveling, and I also got married last August. There was no way I was going to be able to do that along with, eat, sleep, exercise, the things that we have to do as like a human being. So take care of yourselves first. If you need a mental health day, if you need a sick day, if you need time to get off the unit, even though you have 1,000 things going on, take that time because you're not going to get it back. So I'd like to leave everybody with that as my advice.
I just want to echo what everyone's just said so far. I feel like I'm just like nodding my head off here, being like, yes, yeah, exactly. So you've gotten some very, very wise advice. I think my answer would be like a combination of both, as Greg mentioned. I think when I knew I wanted to be a nurse practitioner, and I fell in love with the idea, and everybody was like, you cannot do that straight out of school. It will not work. You will not find a job. And you should not be a pediatric NP. You should be a FNP because you will have more job opportunities. And I was like, the thought of walking into a room and seeing a 40-year-old man sitting at a table, no, like I can only work with kids. And I had so many people doubt that plan that I started to doubt it. And it's like, can I do it? Can I go straight out of school? Can I just pursue a PNP? Should I just be an FNP? And everything worked out, and it's been amazing. I love my job. I love working with kids. I love working with families. And I have to say, the first year, when I would walk into the room, the parents would certainly be like, are we seeing you? How old are you? And I would just kind of like laugh it off and think that I'd have to dress the next day to look a little bit older. And eventually like we'd have a relationship, and I dare say that they fell in love with me too, as much as I loved them. And it has not been a detriment to my career, my experience to come straight out of school, because I had the right opportunities as an undergrad to pursue that. My dean at that time, Dr. Colleen Norton, was fabulous. And all of my teachers knew that I wanted to be an NP, and they arranged my practicum to be an experience that would help me pursue that. They had NP friends that I could shadow. Like I made sure everybody knew what I wanted. And I met with my teachers to get their advice. And that was key to me being able to pursue my career, and has been great. Even after I've graduated, I've still gone back to and talked to them about like certifications that I wanted to pursue. So I think the best advice that I would get, which is also key to how I got here, is connect with your teachers, connect with your peers. Like even here, like there's so much that I'm learning from, what Laura, Greg, and Jen and Donna are saying. So being able to take advantage of the wonderful connections you do make at Georgetown, and keeping those connections once you graduate.
Well, it's tough being last after this group, so this ought to be interesting. But obviously, you are in pretty honorable company with everybody who's here, and so I urge you really to listen very carefully to what they have all said, because it's very, very meaningful. And even me, I learn something every single day. And if I don't open my mind to doing that, then I just probably it's time to move on to do something else. I think it's really impactful what Craig said, just really to open your mind. I am not a young nurse. I'm not a new nurse. And I am in my DMP program, finally. And so I'm in an accelerated program up at MGH, and, you know, I'm in a very small cohort, and I'm working 60 hours a week, and I'm in school full time. I'm doing 10 credits a semester. So I'm a little bit crazed. But at the same time, I can't tell you I've never regretted once, not one time being a nurse, not one time graduating from Georgetown. Your connections are so strong. You're just, again, reinventing yourself for every phase of your life. And just always knowing that the career and the profession of nursing is so special, and that, you know, you really will be able to, you know, find something that at that moment you really love and think, you know what, I'm going to try this. I'm going to pursue this. And you have a village of people around you that will help you. And so that to me is really special, and you should never forget. What I will say is you are entering the field of nursing in the most challenging time that I personally have ever worked. But don't get discouraged. And that's the piece I want to share. You haven't had the same type of clinical we've all had. You've done a lot more sim than all of us have done. You will be fine. You will probably take a little bit longer to feel that level of comfort, but you will all be fine. Don't give up. Don't define yourself by your first 3 months where you're really trying to absorb too much. Just keep your focus on one day at a time. Find your person at your job, wherever that is. Find your people that surround you with support. And anyone that doesn't, you don't need them in your life. And so just always remember that. And again, you know, I urge you to do what Jen said, take care of yourself. You know, it's challenging to graduate from college. It's challenging to start a new job. For some of you, you're moving away from, you know, living with your friends, and who knows where you're going to go after this. But just don't give up. You went into this profession, and you went to Georgetown nursing school for a reason, and that reason will keep coming up. And take your time. Don't rush. If you want to go back to school right away, do it. And don't let anybody tell you you can't. If you need to wait, then do it. And don't let anybody tell you that you will never be able to do it, because I'm going to graduate in November with a DNP. And I am sure that there were times where people would be like, well, if you didn't go back to school already, you probably shouldn't go now. Well, nanny, boo boo, here I am. So again, just stay the course and stay focused, and, you know, just even us on your panel, reach out to us at any time. I've already connected with Eleanor, who's going to do her externship at Hopkins. I've already spoken to a prior nursing student who's going back to New York. I worked at Mount Sinai for 8 years, trying to help her get her summer internship. And just always remain connected to people that will always be there to support you.
Thank you all. Great advice. I mean, yes. And Donna, I mean, on top of everything that you're doing, she is truly connecting with students, and you're here tonight. So thank you so much. I mean, all of you are very busy, but really appreciate that. So to summarize the advice, and, you know, let me just say too, for all you recent grads, yeah, it is an exciting and yet challenging new transition anytime you start a new job, but it is definitely a difficult time for you. And we really appreciate all that you're doing. So anyway, so a summary: ask questions and take it day by day, know your why, follow your passions, and yet keep an open mind and take care of yourself. So great advice. Okay, I've got a question from a student. So for this, you know, whoever wants to just answer first when we go into questions now. So this student wants to know, essentially like how important is it to have an externship, in the summers and really be focused on gaining experiences, opportunities as it relates to nursing, because in part, the student would like to pursue some of their own passions at the same time. So what advice would you have for somebody who's kind of wrestling with that dilemma? Gigi, go ahead.
I'll jump in because I was the first one to have a hard time saying no to things. I was certainly the student who thought like, oh, there's a research opportunity, like I have to apply. Oh, there's an externship, I have to apply. Like I have to do everything because unless I do absolutely everything, I'm not going to get a job, right? Oh, or be accepted at school. And that is not the case. I think college was also a good time to learn a lot about yourself, which I would say is equally as helpful for when you are, out in the real world. For me personally, the externship was helpful because it allowed me to experience something and realize this is actually not the right fit for me. So there are many other ways to pursue that. I think especially nursing, because as you can see, we all have very different lives. And I think that's so exciting and amazing, but you don't necessarily need an externship for that. You can shadow at many places. And though there certainly have a huge benefit, and I really enjoyed doing mine as much as I figured out that it wasn't the right fit, it's not necessarily like a make or break deal. And there are many other things that Georgetown offers that can be equally as enriching to you personally, which is also important.
That's great. And just really quick to piggyback on that, I do know a lot of nursing hospitals, once you receive an offer, then they will let you shadow. And that could be a great opportunity too in terms of exploring. Any other advice on that? Will the student still be an attractive candidate?
I think that they'd be perfectly fine. I graduated with my associates. I had a job before I graduated. I worked on that floor with an amazing preceptor, which I think is a make or break thing. If you have a good preceptor and that's one consistent person for my orientation was 3 months. I felt so prepared. Yes, terrified every single day, but prepared. I went right into the cardiology floor, and I was lucky enough to get my travel job my first travel assignment after 1 year of nursing, which is very rare. But I didn't do an externship. Now, I won't say that I'm not looking into them for nurse practitioner because it's a whole new beast. But if you're someone like Gigi, I think that gets out of nursing school and is like, I'm going to be a pediatric nurse practitioner and nobody is going to stop me, and there was an externship for that, absolutely take it, because you will get some great experience. But it's definitely not necessary, especially in today's climate of nursing. They will take you with whatever experience you have, as long as you know what you want and you're confident and you're competent. Those are the biggest things.
That is, we have not talked about the nursing market, but I am getting bombarded with emails from nursing organizations, and an email will be coming all your way regarding a couple opportunities. So yes. A question from another student is just, any of you familiar with pediatric oncology, and what have you heard or experienced with this specialty, perhaps like the good and the bad of this specialty?
I have some experience with pediatric oncology. And again, I think it really does take a very special person and a different, I could not do pediatric oncology after I had children. I guess for me, I'm just giving you my experience. Before I had children, I thought it was the greatest thing in the world. And, again, Greg spoke about before kind of that, not empathy, because I'm not even sure what word you used at this point, Greg, but your view changes a little bit. I would say if it's something that you think you want to do, then as Jody mentioned and Gigi mentioned, just find somewhere that will allow you to shadow. And there's very different experiences, pediatric oncology inpatient and pediatric oncology outpatient. So, again, don't lump it all together. If you happen to shadow on a transplant unit that is a PD transplant unit and it just completely puts you over the edge, think about what that might feel like as an ambulatory infusion nurse. Very different feel. I mean, you got these kids, rolling in and rolling out. They're incredibly resilient. Like you cannot even believe the difference between starting chemotherapy with a pediatric patient and starting chemotherapy with an adult. It is just like night and day. So, I mean, again, it's hard to give you an exact, but I can tell you it's really a lot of fun. You are taking care of the parents. So just remember that you have many members of your care delivery team. And sometimes it's not the child that is challenging, but it's a fearful parent who, cannot figure out how to get through this. So again, lots to think about, but if you think you want to do that, definitely don't stop.
I think that's one of those areas, peds oncology, that it does really pay to try and do some sort of shadowing. Because as Donna was alluding to, there's so many different flavors of peds oncology. And yes, if you're on the outpatient side and you got these super kids coming in and they're like, and you're like, you are the sun that, brightens everybody's world. You're so strong. That's one thing to see. And another is, I was at Children's for a while on an institutional review board. So we were reviewing all sorts of experimental treatments, and it was mostly oncology. And then these are the kids that really, are sort of at what Donna was also talking about earlier with the adults. This is sort of end of life Hail Mary treatment. And that's a different kind of peds world. And it takes a very special person to go into that and deliver the passion and compassion day in and day out. So I think that is one of those areas where you're thinking, I love peds, I love the challenge of oncologies. Try and explore it if you can with shadowing or talking to people who are in it. So that you can get an idea of all the pieces of it, because there may be some parts that you like more than others. And I guess that goes for almost every specialty, but peds oncology is one of those that just has so many different directions that you can take right off the bat.
Thank you, Greg. And while we have you, there's a question for you. Have you ever wanted to work as just a CNL versus a bedside RN?
So I really looked at that a lot, and I was trying to, so I was the second class at Georgetown, and there were very few places. The Department of Veterans Affairs was the only place that actually hired CNLs and used them, and it was sort of like a nurse hospitalist, like a quarterback to make sure stuff was working right in the hospital from a nursing perspective. And to this day, I haven't really met anybody who is a CNL and I come to work and I'm a CNL. I think a lot of us use the thinking, you've heard it, evidence-based practice. You're really trying to understand the things that are the safest, the most efficient, trying to understand the whys and be able to teach them. So then I think a lot of what people think about when they think of CNL is actually more like an educator or a resource nurse who is kind of the expert on the floor, where they could, other nurses will come to you because they're like, I'm a little puzzled with, how best to approach something. Help me out. And so I haven't really ever run into anybody who sort of has the thing on their shirt that says, RN, CNL, and that they're actually doing clinical nurse leadership work. I think that all of us with the degree use pieces of the schooling in the RN world. And in that way, we are practicing everything that Georgetown wanted us to do in terms of being a clinical leader, a nurse leader, a practice leader, and those sorts of things. So the CNL thing still puzzles me a little bit.
Right. Okay. Well, we have one last question, and then we will end the session tonight. So, do you think that 2 years of nursing experience in your specialty is good to have before going to school to become an NP for that specialty? What's everybody's opinion on that?
I think that's a great question because I certainly thought of this when I was a nurse. I knew I wanted to be a nurse practitioner. The question was when. Like I said, I got my year experience. I went to travel, and I've been traveling for 5 years, and I've been traveling through nurse practitioner school. It depends on the specialty, I think. I think somebody like Laura, who works in an ICU and has done ICU for years, would be perfectly, capable and would do wonderful as an ICU or critical care nurse practitioner. Somebody like me, I've done cardiac and cardiac progressive care for about 6 years, and I don't have any ICU experience, but I am in the acute care program. I have definitely given some thought on, should I go to a staff job and work in an ICU to get that for NP school, or should I just continue on my path? So I don't know if you'll ever really know. I don't think that you're going to hit 2 years and say, okay, yeah, I'm ready. I think it's almost like you could hit 1 year and feel you're ready. You can hit 10 years and feel like you're not ready. I think it really depends on your style of learning, how quick you pick up on things, and your confidence too. Nursing is definitely not all book smarts. You draw on past experiences, and I think that like Gigi went right into school, and clearly she's doing amazing. So it really is, and it's horrible that this is kind of my answer, but it really is individual, and you'll know when you're ready. I know that I'm ready, even without ICU experience. I'm ready to be a hospitalist, or I want to specialize in cardiology. So I know that when I graduate next year, I will be well equipped to do that. And Georgetown also has been an amazing program so far, and I feel even more prepared. So you'll know. It's almost like when you walk on the floor as an RN for the first time, and you're like, you get through a 12-hour shift, and you're like, wow, I'm okay. I wasn't scared today. Like I was confident today, and it kind of just happens, and you don't really even realize it sometimes. It's really kind of amazing.
Makes sense. We can't always plan for when we're going to be ready. Gigi, you also had something that you shared in the chat. Would you mind sharing that?
Yeah, so some programs require experience. So it depends on the kind of NP that you want to be, right? Depends on the populations, women's health, psych, adult, peds. Do you want to do primary care, acute care, critical care? It really depends on the population and the specialty. Some programs, many, will ask for experience. Others won't. That being said, I know people who have experience in a nursing field that's completely unrelated to what they're pursuing their nurse practitioner degree in. And people who have experience in other jobs, non-nursing, that enriches their pathway to becoming an NP. So it really is very independent. It's very unique to your path. But I will say, knowing, you should know the answer once you know exactly the kind of NP that you want to be. So shadowing, having a day in their life will help you then make that decision. I've had students, I precept for Georgetown's Peds Clinical as well. I haven't in the past year, but I've had students who then come to me asking for letters of recommendation because they're pursuing an NP school a year out. And I've had students from 5 years out that are now considering. And so now they want to talk again because they want to shadow and pursue that. So it really depends on your life. I will say it will consume your life. And I think Donna and Jen will agree. So it's not just about you being ready. It's about your life being prepared for that, because you will eat, breathe, and sleep NP school. So that's something else to take into account.
That is all I do, is go to work and go to school. Yes, and yes. And if I want to do anything else, I have to plan very carefully. Yeah. So just make sure that you're ready. Because it really, Gigi's right, it does consume your life.
I think it's equally as important to be because I think we at Georgetown always think am I academically ready, right? Is my knowledge there? But equally as important, and sometimes more so, is whether you're in a mental space where you can deal with the stress of it, and whether you're in a life position where you can pursue it.
so I actually finished 2/3 of the Georgetown FNP program online while working, raising a family, and this, that, and the other thing. And then I realized that FNP wasn't for me. And this was through COVID. And so I have taken a year or so to think about it. And I think that if I went back to NP school, I would, and this goes back to my emergency room, nurse beginnings, was I'd be where Jen is, thinking about acute care, and not the family thing, because family is wellness, and it's an animal of its own, and I didn't know it. And so I think feel free and feel confident and comfortable changing your course. So you wanted to dive into something and you took every externship and you did that and the other thing, and you said, gosh, this really isn't for me. That is totally cool. That is something that then it's a piece of knowledge for you. You're not going to lose any time really, because you have those new skills, but it's not a mark against you. Continue to follow your heart on this one, and you will find the place. And I'm sort of living proof of that, because I lived, breathed, and ate it for 18 months, and and then I thought, maybe not, and I took a break, and I'm still on that break, and I'll pick it up some other time.